You make me sick.
What's the matter, son?
Sharp stabbing pains in my stomach.
What's up, party people? Hey, it's Dr. Buck, and I'm back with another video. In this video, we're gonna do another what to do when, or as I like to call it, don't be an idiot. In this video, we're going to talk about when to seek medical attention for digestive problems. There's going to be a few different things in this one. So some of them are going to be sort of related to swallowing and some abdominal pain and things like that. But we're going to lump them into like sort of digestive problems. Here are 5 reasons you probably should seek medical attention if you have a digestive issue. Number 1, severe or persistent abdominal pain. This is kind of my wheelhouse. This is basically what I did for a really long time is severe abdominal pain. I took care of appendicitis, cholecystitis, which is rotten gallbladder, diverticulitis, cecal volvulus, pancreatitis, perforated ulcers, all that good stuff. So let's go over this just a little bit more since this is kind of my specialty. So severe abdominal pain, what does that mean? Well, typically in a hospital, if you've been in the hospital before, you'll notice that nurses say, what is your pain on a scale of 1 to 10? 10 being the worst pain you ever felt in your life, and 1 being essentially, yeah, it's there, but I don't really notice it. So severe is all subjective to everybody, but I think if it's me and I have pain that's more than 7 out of 10 for any period of time, as in maybe a few hours, I would probably seek medical attention. In fact, I'll tell you a story. When I was on call one time, I got a really bad right lower quadrant pain, which is kind of classic for appendicitis. Now, it's not exactly classic, and my pain wasn't totally classic, but I did have some vague abdominal pain before that, and then it was a right lower quadrant, but I knew that the time frame really didn't fit. But it was so bad, in like 2 hours, I called the ER. I was like, yo, I think I have appendicitis, but I'm the only guy on call and the only guy in town right now that can do appendicitis. What am I gonna do? And they laughed and were like, okay, let's call the other surgeon and see where they are. So I basically went in, had a CAT scan done or something like that, got some pain medication, not the narcotics because I was on call, obviously. They went away with Toradol, which is a drug that I love because it's not a narcotic, but it's a really good pain medication. Anyway, beside the point, I did not have appendicitis, but the point is that I am a serious wussy, and it took me like 2 hours. I would classify that pain as probably like an 8 to 9 out of 10. So it really didn't take me very long. So here's the deal. If you have pain 7 out of 10 or more than a few hours, I would probably go in or at least call somebody. A friend that's a doctor or urgent care, somebody to talk to. Even telemedicine these days is kind of good. For me, it only took me a couple hours with a pain of like 8 to 9 out of 10. So what are the problems with that? If you have appendicitis, cholecystitis is rotten gallbladder, perforated diverticulitis or a cecal volvulus, perforated ulcer right in your stomach, pancreatitis, all those things need treatment pretty quick within, I would say, 6 to 12 hours. The thing is, what we see is the patients that come in super early with appendicitis and they're a wussy or whatever you want to call it, it's super easy to treat them and they get in and out, and it's like literally like a half an hour, 45-minute operation, and the patient sometimes can go home the same day. Compare that to, say, appendicitis, where somebody has waited for 5 days, they stuck it out because they didn't want to go into the hospital, they didn't want to see a doctor, didn't want to know what it was, and they stayed at home. And I see this a lot, mostly in, I would say, like older stoic men. They don't want to go in, they're sort of stubborn, like the farmer's like the classic, like they're so tough, they don't go in for anything, and then when they do come in, you're like, oh my god, a farmer's here, like this guy's probably on his deathbed, let's go see him real quick. So what happens is a lot of times the appendix can perforate, then you have a massive problem, stool that spills in the abdomen, you have all this stuff going on. So that patient could stay there for weeks. They can even die, like I've had patients die with appendicitis. If you go in early, the appendix is not ruptured yet, it's just a little pissed off. You go in there, you clip it, take it out, it's done, little teeny incisions, no big deal. If you wait for a long time, it's perforated, lots of stool in the abdomen, big incision all the way down the belly, open it up, wash it out, ICU, ventilator, weeks in the hospital, recovery, all that stuff. So it's a disaster. So my point is, obviously, sooner than later is better. So if you have severe abdominal pain for any reason, whether it's right lower quadrant, right upper quadrant, that's gallbladder, right lower quadrant's appendix, left lower quadrant is typically a diverticulitis. A lot of other things can happen. Anyway, point is, severe abdominal pain or persistent abdominal pain. If it's really high, if it's a 5, 6, and it's there for a couple days, maybe you want to think about going in. Number 2, bloody stool. We always hear about bloody stools being cancer, and yes, they can can be, but most of the time they're not. But you need to check it out. So if you have some bloody stools, most of the time your bloody stool is going to be just some hemorrhoids. But we do need to make sure it's not something that's more serious. Like, again, the sooner the better. So if you come in, you get checked out, you're like, oh, it's some hemorrhoids, you can get out of here, no problem. You need some stool softeners, you need this, you need that, whatever. No big deal. Number one, it saves you from pain because sometimes they can be very painful. And number two, if it's not that and we catch a small problem, sometimes with gastrointestinal tumors, you can just do a scope. You know what this is? I think we know. You do a scope, you put the camera up to you know where, you can take a look in the colon, and if you find a very small tumor or growth, you can clip it out with the scope. If you wait for a really long time and it gets to be a big tumor, then you need a big operation to get that out, and it's a bigger deal. So again, bloody stools, you can save yourself a lot of hassle and pain, number one. And number two, the big one is if you get a tumor early, you can save yourself a lot of pain and suffering. Persistent diarrhea. Now this is something that sort of goes along with the bloody stools. You can have persistent diarrhea that is also bloody or bloody diarrhea, two different tracks that you can find problems with. Anyways, we're gonna stick with persistent diarrhea, and if you have some blood in that diarrhea, we're gonna lump it into inflammation, infection. If you have persistent diarrhea, it could be things like Crohn's, ulcerative colitis, or infections, right? If you go to another country, it's more common in other countries, but you can have it in the United States. E. coli, these bloody diarrhea type of bacteria. So the reason you want to get treated, you want to see somebody for these, is because we have good treatments for them, especially if it's early. Again, kind of a theme, but we can give you antibiotics for these bacterial infections, and we can give you a lot of different type of medications, sometimes steroids for Crohn's disease and ulcerative colitis. Plus, if you have Crohn's or ulcerative colitis, it can be like a chronic thing, and if you get plugged into the right people and the right specialists, they can really help you manage those things really well so that you don't really notice these problems very much. And so if you're having persistent diarrhea, you're like, I don't want to leave the house because I'm gonna my pants. Well, you can have a specialist help you with that and manage all those things so you can go out and do fun stuff. If you're scared to leave the house, that is a problem. So go in, see somebody, get managed, get plugged into the system. That way you can have a good life even with one of these things. Number 4, unexplained weight loss. Unexplained weight loss is kind of like a very broad term that we use, and it's really hard for people to sort of categorize themselves in that because a lot of people that have unexplained weight loss don't typically think of themselves as having unexplained weight loss. And then those that don't have unexplained weight loss, but they think they are, come in with it. So it's kind of weird. But anyway, the point is if you're losing weight over 2, 3, 6 months, something like that, and you really haven't changed much, and people are like, hey, are you losing weight? You look skinnier. And you're like, no, I'm not really doing anything. Things like that going on, or you're feeling weak or fatigued, especially if you have some other symptoms, then you probably want to come in and see somebody, because these are also some common things are ulcerative colitis, Crohn's disease, which are sort of like inflammatory bowel disease, as well as gastrointestinal tumors. So some of them just like make you not want to eat. You can't fill up your stomach because like there's a tumor there and there's like too much space in your stomach, and so you don't physically want to eat because you feel like you're full all the time. Or some other things are just like filling you up or making you not feel well. But also one of the things that tumors do is sort of like take all of your energy, and so they're spending all the calories that you're taking. Even though you're taking the normal amount of calories, the tumor is spending more calories than you're eating, and you're losing weight. So that's what happens. So you want to go in obviously sooner than later, because then you have a much higher chance of being totally cured as compared to if you find a tumor very late. And number 5 is difficulty swallowing. So there's a few things that can happen with difficulty swallowing. So if you are swallowing and you feel like I can swallow, like my muscles work, and then it just sticks really bad in a spot. So we can have things in our esophagus, or esophagus is essentially the tube that goes from your mouth to the stomach. You can have problems with the esophagus. They can have motility problems. The muscle sort of doesn't work in the right sequence. It doesn't like squeeze at the top and then relax at the bottom. And so the food, you know what I'm saying? Like it doesn't squeeze like all the way down. So that can be kind of messed up, and that's sort of a nervous problem, a nervous system problem. You can have a stricture. If you have some sort of an injury in the esophagus can go from a tube like this to going way tight and you can't get any food past it, that's also can be an issue. Obviously, tumors, if you have a tumor esophagus and that's sort of blocking the food from going down, then you're gonna have problems swallowing. The other sort of swallowing problems you can have, or sort of like, I can't swallow. I'm trying to swallow, but the muscles don't feel like they want to do it. So that's another sort of nervous problem, a lot of times associated with some kind of a stroke or things like that. So you want to go in and get those evaluated as soon as possible, sooner than later. Some of these things are emergent and some of them are not emergent. If you go into the emergency room and they say, well, this is not emergent, we need to go get scoped, we're going to set you up on Monday, blah, 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 that's okay. But sometimes if you are a higher risk person and you can't swallow and you haven't been swallowing for like 6 months and you are losing weight, blah, 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 then maybe you're so cachectic or like you lost so much weight that you can't get up, you can't walk, you can't eat, you can't do all this stuff, and you may need sort of a feeding tube and things like that. Point is some of these things with swallowing difficulty are emergencies, like as you need to get them fixed in a couple days, and some of them are not, as in they might either send you home and have you come back and follow up with somebody, or put you in the hospital, what we call like beef you up, give you some food so all your stuff, all your tissues and things like that work again, because if you have starving them, like all your tissues are sort of melting, and then any procedure after that is going to be very difficult for you to heal from. So those are the 5 reasons you might want to seek medical attention sooner than later if you have some digestive issues. Hope you like these videos. If you like the video, like the video, please. If you think someone would benefit from this video, please share it with them. And if you have not subscribed to the channel, please do that. That helps us out a lot. I will see you in the next one.